Episode 16: Ethical Use of Broad Spectrum Antivirals in Unproven Conditions. Welcome back to Ribavirin Reminiscence and Lingering Load in Long COVID-19. I'm your host Anushka, a genomics explorer who's unraveled the intricate codes of life to understand disease and treatment. Today, we are stepping into an ethical labyrinth. Should we wield broad-spectrum antivirals like ribavirin in conditions like long COVID, where evidence is as thin as the spider's web, yet desperation runs deep? Joining us is Saakshi, a master's student in microbiology whose expertise in microbial dynamics offers critical insights into this dilemma. Saakshi, thank you for joining us.
Thank you, Anushka. I'm eager to dive into this complex and nuanced discussion.
Let's begin by charting the terrain. Off-label use is like sailing uncharted sea in medicine, a beacon of hope yet fraught with hidden reefs. Sakshi, what does off-label use mean in practice, and why is it both promising and perilous?
Off-label use refers to prescribing a drug for a condition, dose, or duration not approved by regulatory bodies like the FDA. It's legal and often vital in medicine, particularly for rare diseases or even emerging infections where approved treatments are scarce. However, with ribavirin, the stakes are high due to its serious side effects such as hemolytic anemia, teratogenicity, and even neurotoxicity. In long COVID, where the disease mechanisms are still unclear, off-label use risks exposing patients to harm without guaranteed benefits, hence making ethical considerations paramount.
Long COVID patients are often trapped in a cloud of unrelenting symptoms, grasping for any lifeline. How does this desperation shape the ethical landscape of using unproven treatments like ribavirin?
Desperation significantly influences the ethical calculus. Patients suffering from chronic symptoms like fatigue, brain fog, or pain are more likely to embrace risky, unproven treatments, sometimes bypassing clinical trials. This places a heavy responsibility on clinicians and researchers to avoid therapeutic misestimation, offering false hope without evidence. We must ensure transparent communication of risks and uncertainties to prevent medicine from becoming wishful experimentation, particularly with a drug like ribavirin that carries substantial risks.
Ribavirin's side effects loom like storm clouds on the horizon. How do these risks weigh in the decision to use it for long COVID, where the benefits remain uncertain?
Ribavirin's side effects, such as hemolytic anemia, teratogenicity, and neurotoxicity, are not trivial. These must be weighed heavily, especially since long COVID, while debilitating, is rarely life-threatening like hepatitis C or Lassa fever. The drug should only be considered if the condition is severe, there's a reasonable chance of benefit, and no safer alternatives exist. Without clear evidence of viral persistence in long COVID, the risk of worsening symptoms like fatigue or cognitive issues raises serious ethical concerns.
So, what's the safest path forward then? Are clinical trials the golden key to ethically unlocking ribavirin's potential in long COVID?
Clinical trials are the most ethical ways to explore ribavirin's potential. They provide oversight, strict inclusion criteria, like confirmed PCR persistence or immune dysregulation, and data monitoring to assess efficacy and safety too. Wildcat prescribing based on anecdotes or social media hype risks harm and erodes trust. Trials ensure structured learning, advancing our understanding while protecting the patients.
So it's safe to say it's like a tightrope walk between honoring a patient's right to choose and ensuring that choice is grounded in reason. How do we balance patient autonomy with professional responsibility?
Patient autonomy is critical, but it does not override medical responsibility. Clinicians are not mere dispensers of prescriptions. They must ensure interventions are proportional and evidence informed. Informed consent is essential but insufficient, especially with ribavirin's population level risks like teratogenicity. Ethical prescribing requires a shared decision making process that respects patient wishes while prioritizing safety and scientific rigor.
In the digital age, hope can ignite like wildfire online, blurring the line between anecdote and evidence. How does social media complicate the ethics of off label antiviral use?
Social media amplifies anecdotal success stories, creating demand for unproven treatments like ribavirin. A viral X post about symptom relief can outpace scientific evidence, pressuring clinicians and skewing patient expectations. While patient voices are vital, this hype must be balanced with independent data, responsible journalism, and clinician humility to prevent harm from unverified claims.
If we were to sketch a blueprint for ethical off-label use of ribavirin in long COVID, what pillars would support it?
An ethical model would include, first, a clear clinical rationale, such as evidence of viral persistence. Second, would be shared decision making, free from coercion, with full transparency. Another could be rigorous monitoring, like the blood counts, cognitive assessment, pregnancy prevention. Another is data sharing to build a collective evidence base. Last but not the least, a defined exit strategy, stopping treatment if no benefit emerges. Registries or trials would further ensure outcomes contribute to structured learning, hence moving us beyond scattered anecdotes.
Saakshi, thank you for guiding us through this ethical maze. You have shown that hope must be anchored in evidence and compassion to truly serve long COVID patients.
Thank you, Anushka. Ethics and evidence are our compass in this uncertain terrain, ensuring we help without harming.
Next week, we'll hear from patients themselves stories of those who have tried antivirals against long COVID and the compromises they have faced. Until then, I'm Anushka. Stay careful, stay compassionate, and stay informed.